Unit 7 Assessing Health 29 Vital Signs 47730 Health Assessment 513. Introduction. Introduction. The traditional vital signs are body temperature, pulse, respirations, and blood pressure. Many agencies such as the Veterans Administration, American Pain Society, and the Joint Commission have designated pain as a fifth vital sign, to be assessed at the same time as each of the other four. Pain assessment is covered in Chapter 46. Oxygen saturation is also commonly measured at the same time as the traditional vital signs. Vital signs, which should be looked at in total, are checked to monitor the functions of the body. The signs reflect changes in function that otherwise might not be observed. Monitoring a client's vital signs should not be an automatic or routine procedure, it should be a thoughtful, scientific assessment. Vital signs should be evaluated with reference to client's present and prior health status, their usual vital sign results, if known, and accepted normal standards. When and how often to assess a specific client's vital signs are chiefly nursing judgments, depending on the client's health status. Some agencies have policies about when to take clients' vital signs. The primary care provider may specifically order a vital sign, example, blood pressure Q2H. Ordered vital sign measurements, however, should be considered the minimum. A nurse should assess vital signs more often if the client's health status requires it. Examples of times to assess vital signs are listed in box 29-1. Often, someone other than the nurse measures the client's vital signs. The nurse must recall, however, that prior to delegating this task to unlicensed assistive personnel, UAP, the nurse must have assessed the individual client and determined that the client is medically stable or in a chronic condition, and not fragile, and that the vital sign measurement is considered routine for this client. Under those circumstances, the UAP may measure, record, and report vital signs. Learning outcomes. After completing this chapter, you will be able to 1. Describe factors that affect the vital signs and accurate measurement of them. 2. Identify the variations in normal body temperature, pulse, respirations, and blood pressure that occur from infancy to old age. 3. Verbalize the steps used in A. Assessing body temperature. B. Assessing a peripheral pulse. C. Assessing the apical pulse and the apical radial pulse. D. Assessing respirations. E. Assessing blood pressure. F. Assessing blood oxygenation using pulse oximetry. Key terms. Afebrile, 479 apical pulse, 487 apical radial pulse, 494 apnea, 497 arrhythmia, 489 arterial blood pressure, 499 arteriosclerosis, 500 auscultatory gap, 503 basal metabolic rate, BMR, 478 body temperature, 478 bradycardia, 489 bradypnea, 497 cardiac output, 487 compliance, 487 conduction, 478 constant fever, 479 convection, 478 core temperature, 478 costal, thoracic, breathing, 496 diaphragmatic, abdominal, breathing, 496 diastolic pressure, 499 dysrhythmia, 489 evaporation, 478 exhalation, 496 expiration, 496 febrile, 479 fever, 479 fever spike, 479 heat balance, 478 heat exhaustion, 479 heat stroke, 480 hematocrit, 500 hyperpyrexia, 479 hypertension, 500 hyperthermia, 479 hyperventilation, 497 hypotension, 501 hypothermia, 480 hypoventilation, 497 inhalation, 496 insensible heat loss, 478 insensible water loss, 478 inspiration, 496 intermittent fever, 479 Kortkoff sounds, 503 mean arterial pressure, MAP, 499 orthostatic hypotension, 501 oxygen saturation, SAW2, 507 peripheral pulse, 487 point of maximal impulse, PMI, 487 pulse, 487 pulse deficit, 494 pulse oximeter, 507 pulse pressure, 499 pulse rhythm, 489 pulse volume, 489 pyrexia, 479 radiation, 478 relapsing fever, 479 remittent fever, 479 respiration, 496 respiratory character, 497 respiratory quality, 497 respiratory rhythm, 497 sphygmomanometer, 501 surface temperature, 478 systolic pressure, 499 tachycardia, 489 tachypnea, 497 tidal volume, 497 ventilation, 496 vital signs, 477 29 vital signs. 4. Describe appropriate nursing care for alterations in vital signs. 5. Identify 9 sites used to assess the pulse, and state the reasons for their use. 6. List the characteristics that should be included when assess ING pulses. 7. Describe the mechanics of breathing, and the mechanisms that control respirations. 8. Recognize when it is appropriate to delegate measurement of vital signs to unlicensed assistive personnel. 9. Demonstrate appropriate documentation and reporting of vital signs. M29B_BERM 4362_10_SE_CH29.IND 477 February 12, 14, 5:51 p.m. 478 Unit 7 Assessing Health. Number 153613 CUST, Pearson O. Berman PG Number 478 Title, Kosier, and Herbs Fundamentals of Nursing 10 EC/M/Y/K/Normal Design Services of S4 Carlisle Publishing Services Number 153613 CUST, Pearson O. Berman PG Number 478 Title, Kosier and Herbs Fundamentals of Nursing 10 EC/M/Y/K/Normal Design Services of S4 Carlisle Publishing Services. 2. Muscle activity. Muscle activity, including shivering, increases the metabolic rate. 3. Thyroxine output. Increased thyroxine output increases the rate of cellular metabolism throughout the body. 4. Epinephrine, norepinephrine, and sympathetic stimulation/stress response. These hormones immediately increase the rate of cellular metabolism in many body tissues. 5. Fever. Fever increases the cellular metabolic rate, and thus increases the body's temperature further. Heat is lost from the body through radiation, conduction, convection, and evaporation. Radiation is the transfer of heat from the surface of one object to the surface of another without contact between the two objects, mostly in the form of infrared rays. Conduction is the transfer of heat from one molecule to a molecule of lower temperature. Conductive transfer cannot take place without contact between the molecules and normally accounts for minimal heat loss except, for example, when a body is immersed in cold water. The amount of heat transferred depends on the temperature difference and the amount and duration of the contact. Convection is the dispersion of heat by air currents. The body usually has a small amount of warm air adjacent to it. This warm air rises and is replaced by cooler air, so people always lose a small amount of heat through convection. Evaporation is continuous vaporization of moisture from the respiratory tract and from the mucosa of the mouth and from the skin. This continuous and unnoticed water loss is called insensible water loss, and the accompanying heat loss is called insensible heat loss. Insensible heat loss accounts for about 10% of basal heat loss. When the body temperature increases, vaporization accounts for greater heat loss. But real assessment, interpretation of the measurements, rests with the registered nurse. Body temperature. Body temperature reflects the balance between the heat produced and the heat lost from the body, and is measured in heat units called degrees. There are two kinds of body temperature, core temperature and surface temperature. Core temperature is the temperature of the deep tissues of the body, such as the abdominal cavity and pelvic cavity. It remains relatively constant. The normal core body temperature is a range of temperatures, figure 29:1. The surface temperature is the temperature of the skin, the subcutaneous tissue, and fat. It, by contrast, rises and falls in response to the environment. The body continually produces heat as a byproduct of metabolism. When the amount of heat produced by the body equals the amount of heat lost, the person is in heat balance, figure 29:2. A number of factors affect the body's heat production. The most important are these 5. 1. Basal metabolic rate. The basal metabolic rate, BMR, is the rate of energy utilization in the body required to maintain essential activities such as breathing. Metabolic rates decrease with age. In general, the younger the person, the higher the BMR. Box 29:1 times to assess vital signs. On admission to a healthcare agency to obtain baseline data, when a client has a change in health status or reports symptoms such as chest pain, or feeling hot or faint before and after surgery, or an invasive procedure before and or after the administration of a medication that could affect the respiratory or cardiovascular systems. For example, before giving a digitalis preparation before and after any nursing intervention that could affect the vital signs. Example: ambulating a client who has been on bed rest. Fahrenheit centigrade. Usual range of normal. Figure 29:1 estimated ranges of body temperatures in healthy adults. Heat production, heat loss. Basal metabolic rate, exercise/shivering, secretion of thyroxine, epinephrine, and norepinephrine, inhalation/fever. Radiation, conduction, convection, evaporation. Heat loss. ET evaporation equals. Figure 29:2 As long as heat production and heat loss are properly balanced, body temperature remains constant. Factors contributing to heat production and temperature rise are shown on the left. Those contributing to heat loss and temperature fall are shown on the right. M29B_Berm 4362_10_SE_CH29.IND 478 February 12, 14, 5:51 p.m. Chapter 29 Vital Signs 479. Number 153613 CUST, Pearson, Berman PG. Number 479 Title, Kosier and Herbs Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. Of ovulation raises body temperature by about 0.3 degrees Celsius to 0.6 degrees Celsius, 0.5 degrees Fahrenheit to 1.0 degrees Fahrenheit, above basal temperature. 5. Stress. Stimulation of the sympathetic nervous system can increase the production of epinephrine and norepinephrine, thereby increasing metabolic activity and heat production. Nurses should anticipate that a highly stressed or anxious client could have an elevated body temperature for that reason. 6. Environment. Extremes in environmental temperatures can affect a person's temperature regulatory systems. If the temperature is assessed in a very warm room and the body temperature cannot be modified by convection, conduction, or radiation, the temperature will be elevated. Similarly, if the client has been outside in cold weather without suitable clothing, or if a medical condition prevents the client from controlling the temperature in the environment, example, the client has altered mental status or cannot dress self, the body temperature may be low. Alterations in body temperature. The normal range for adults is considered to be between 36 degrees Celsius and 37.5 degrees Celsius, 96.8 degrees Fahrenheit to 99.5 degrees Fahrenheit. There are two primary alterations in body temperature, pyrexia and hypothermia. Pyrexia, a body temperature above the usual range, is called pyrexia. Hyperthermia, or, in lay terms, fever. A very high fever, such as 41 degrees Celsius, 105.8 degrees Fahrenheit, is called hyperpyrexia, figure 29:4. The client who has a fever is referred to as febrile, the one who does not is afebrile. For common types of fevers are intermittent, remittent, relapsing, and constant. During an intermittent fever, the body temperature alternates at regular intervals between periods of fever and periods of normal or subnormal temperatures. An example is with the disease malaria. During a remittent fever, such as with a cold or influenza, a wide range of temperature fluctuations, more than 2 degrees Celsius, 3.6 degrees Fahrenheit, occurs over a 24-hour period, all of which are above normal. In a relapsing fever, short febrile periods of a few days are interspersed with periods of 1 or 2 days of normal temperature. During a constant fever, the body temperature fluctuates minimally, but always remains above normal. This can occur with typhoid fever, a temperature that rises to fever level rapidly following a normal temperature, and then returns to normal within a few hours is called a fever spike. Bacterial blood infections often cause fever spikes. In some conditions, an elevated temperature is not a true fever. 2 examples are heat exhaustion and heat stroke. Heat exhaustion is a result of excessive heat and dehydration. Signs of heat exhaustion include paleness, dizziness, nausea, vomiting, fainting, and a moderately increased temperature, 38.3 degrees Celsius to 38.9 degrees Celsius, 101 degrees Fahrenheit to 102 degrees Fahrenheit. Regulation of body temperature. The system that regulates body temperature has 3 main parts: sensors in the periphery and in the core, an integrator in the hypothalamus, and an effector system that adjusts the production and loss of heat. Most sensors or sensory receptors are in the skin. The skin has more receptors for cold than warmth. Therefore, skin sensors detect cold more efficiently than warmth. When the skin becomes chilled over the entire body, 3 physiological processes to increase the body temperature take place. 1. Shivering increases heat production. 2. Sweating is inhibited to decrease heat loss. 3. Vasoconstriction decreases heat loss. The hypothalamic integrator is the center that controls the core temperature. When the integrator detects heat, it sends out signals intended to reduce the temperature, that is, to decrease heat production and increase heat loss. In contrast, when the cold sensors are stimulated, the integrator sends out signals to increase heat production and decrease heat loss. The signals from the cold-sensitive receptors of the hypothalamus initiate effectors, such as vasoconstriction, shivering, and the release of epinephrine, which increases cellular metabolism and hence heat production. When the warmth-sensitive receptors in the hypothalamus are stimulated, the effector system sends out signals that initiate sweating and peripheral vasodilation. Also, when this system is stimulated, the person consciously makes appropriate adjustments, such as putting on additional clothing in response to cold or turning on a fan in response to heat. Factors affecting body temperature. Nurses should be aware of the factors that can affect a client's body temperature so that they can recognize normal temperature variations and understand the significance of body temperature measurements that deviate from normal. Among the factors that affect body temperature are the following. 1. Age. Infants are greatly influenced by the temperature of the environment and must be protected from extreme changes. Children's temperatures vary more than those of adults do until puberty. Many older people, particularly those over 75 years, are at risk of hypothermia, temperatures below 36 degrees Celsius or 96.8 degrees Fahrenheit, for a variety of reasons, such as inadequate diet, loss of subcutaneous fat, lack of activity, and reduced thermoregulatory efficiency. Older adults are also particularly sensitive to extremes in the environmental temperature due to decreased thermoregulatory controls. 2. Diurnal variations, circadian rhythms. Body temperatures normally change throughout the day, varying as much as 1.0 degrees Celsius, 1.8 degrees Fahrenheit, between the early morning and the late afternoon. The point of highest body temperature is usually reached between 1600 and 1800 hours, 4 p.m., and 6 p.m., and the lowest point is reached during sleep between 0400 and 0600 hours, 4 a.m. and 6 a.m., figure 29-3. Older adults' temperatures may vary less than those of younger persons due to the changes in autonomic functioning common in aging. Marigold, Arias, Vassallo, Allen, and Kwan, 2011. 3. Exercise. Hard work or strenuous exercise can increase body temperature to as high as 38.3 degrees Celsius to 40 degrees Celsius, 101 degrees Fahrenheit to 104 degrees Fahrenheit, may assured rectally. 4. Hormones. Women usually experience more hormone fluctuations than men. In women, progesterone secretion at the time 37.2, 37.0, 36.8, 36.6, 36.4, 36.2. 04004 AM 08008 AM 1212 noon 1604 PM 2008 PM 2412 midnight 04004 AM. Awake asleep. Time, hours. Oral temperature, degree C. Figure 29-3 range of oral temperatures during 24 hours for a healthy young adult. M29B_Berm 4362_10_SE_CH29.IND 479 February 12, 14, 5:51 p.m. 480 Unit 7 Assessing Health. Number 153613 CUST, Pearson, Berman PG Number 480 Title, Kosier, and Herbs Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. A lower value, perhaps even back to the original normal level. In this instance, the hypothalamus now attempts to lower the temperature, and the usual heat loss responses that cause a reduction of the body temperature occur: excessive sweating and hot, flushed skin due to sudden vasodilation. This is referred to as the flush phase. Nursing interventions for a client who has a fever are designed to support the body's normal physiological processes, provide comfort, and prevent complications. During the course of a fever, the nurse needs to monitor the client's vital signs closely. Nursing interventions during the chill phase are designed to help the client decrease heat loss. At this time, the body's physiological processes are attempting to raise the core temperature to the new set point temperature. During the flush or crisis phase, the body processes are attempting to lower the core temperature to the reduced or normal set point temperature. At this time, the nurse takes measures to increase heat loss and decrease heat production. Nursing interventions for a client with fever are shown in box 29-2. Hypothermia. Hypothermia is a core body temperature below the lower limit of normal. The three physiological mechanisms of hypothermia are: A. Excessive heat loss, B. Inadequate heat production to counteract heat loss, and C. Impaired hypothalamic thermoregulation. The clinical signs of hypothermia are listed in the clinical manifestations box. Hypothermia may be induced or accidental. Induced hypothermia is the deliberate lowering of the body temperature to decrease the need for oxygen by the body tissues, such as during certain surgeries. Accidental hypothermia can occur as a result of A. Exposure to a cold environment, B. Immersion in cold water, and C. Lack of adequate clothing, shelter, or heat. In older adults, the problem can be compounded by a decreased metabolic rate and the use of sedative medications. If skin and underlying tissues are damaged by freezing cold. Persons experiencing heat stroke generally have been exercising in hot weather, have warm, flushed skin, and often do not sweat. They usually have a temperature of 41.1 degrees Celsius 106 degrees Fahrenheit or higher, and may be delirious, unconscious, or having seizures. The clinical signs of fever vary with the onset, course, and abatement stages of the fever. See clinical manifestations. These signs occur as a result of changes in the set point of the temperature control mechanism regulated by the hypothalamus. Under normal conditions, whenever the core temperature rises, the rate of heat loss is increased, resulting in a fall in temperature toward the set point level. Conversely, when the core temperature falls, the rate of heat production is increased, resulting in a rise in temperature toward the set point. In a fever, however, the set point of the hypothalamic thermostat changes suddenly from the normal level to a higher than normal value. Example, 39.5 degrees Celsius, 103.1 degrees Fahrenheit, as a result of the effects of tissue destruction. Pyrogenic substances, or dehydration on the hypothalamus. Although the set point changes rapidly, the core body temperature, i.e., the blood temperature, reaches this new set point only after several hours. During this interval, the usual heat production responses that cause elevation of the body temperature occur: chills, feeling of coldness, cold skin due to vasoconstriction, and shivering. This is referred to as the chill phase. When the core temperature reaches the new set point, the person feels neither cold nor hot, and no longer experiences chills, the plateau phase. Depending on the degree of temperature elevation, other signs may occur during the course of the fever. Very high temperatures, such as 41 degrees Celsius to 42 degrees Celsius, 106 degrees Fahrenheit to 108 degrees Fahrenheit, damage the parenchyma of cells throughout the body, particularly in the brain where destruction of neuronal cells is irreversible. Damage to the liver, kidneys, and other body organs can also be great enough to disrupt functioning and eventually cause death. When the cause of the high temperature is suddenly removed, the set point of the hypothalamic thermostat is suddenly reduced to degree F degree C, 42, 41, 40, 39, 38, 37, 36, 35, 34, 107.6, 105.8, 104.0, 102.2, 100.4, 98.6, 96.8, 95.0, 93.2. Normal range. Death. Average. Pyrexia. Hyperpyrexia. Hypothermia. Figure 29 to 4 terms used to describe alterations in body temperature, oral measurements, and ranges in Fahrenheit and Celsius, centigrade, scales. Clinical manifestations. Fever onset, cold or chill phase, increased heart rate, increased respiratory rate, and depth, shivering, pallid, cold skin, complaints of feeling cold, cyanotic nail beds, gooseflesh, appearance of the skin, cessation of sweating. Course, plateau phase, absence of chills, skin that feels warm, photosensitivity, glassy-eyed appearance, increased pulse and respiratory rates, increased thirst, mild to severe dehydration, drowsiness, restlessness, delirium, or convulsions, herpetic lesions of the mouth, loss of appetite, if the fever is prolonged, malaise, weakness, and aching muscles. Defervescence, fever abatement / flush phase, skin that appears flushed and feels warm, sweating, decreased shivering, possible dehydration. M29B_Berm 4362_10_SE_CH29.IND 480 February 12, 14, 5:51 p.m. Chapter 29 Vital Signs 481. Number 153613 CUST, Pearson, Berman PG. Number 481. Title, Kosier and Herbs, Fundamentals of Nursing 10 EC/M/Y/K short/ Normal Design Services of S4 Carlisle Publishing Services. With severe hypothermia, a hyperthermia blanket, an electronically controlled blanket that provides a specified temperature, is applied, and warm intravenous fluids are given. Wet clothing, which increases heat loss because of the high conductivity of water, should be replaced with dry clothing. See Box 29-3 for nursing interventions for clients who have hypothermia. Assessing body temperature. The most common sites for measuring body temperature are oral, rectal, axillary, tympanic membrane, and skin/temporal artery. Each of the sites has advantages and disadvantages. Table 29:1. The body temperature may be measured orally. If a client has been taking cold or hot food or fluids or smoking, the nurse should wait 30 minutes before taking the temperature orally to ensure that the temperature of the mouth is not affected by the temperature of the food, fluid, or warm smoke. Rectal temperature readings are considered to be very accurate. Rectal temperatures are contraindicated for clients who undergo rectal surgery, have diarrhea, or diseases of the rectum, are immunosuppressed, have a clotting disorder, or have significant hemorrhoids. The axilla is often the preferred site for measuring temperature in newborns because it is accessible and safe. Axillary temperatures are lower than rectal temperatures. Some clinicians recommend checking an elevated axillary temperature with one taken from an other site to confirm the degree of elevation. Nurses should check agency protocol when taking the temperature of newborns, infants, toddlers, and children. Adult clients for whom the axillary method of temperature assessment is appropriate include those for whom other temperature sites are contraindicated. Nursing interventions for clients with fever. Box 29-2. Monitor vital signs. Assess skin color and temperature. Monitor white blood cell count, hematocrit value, and other pertinent laboratory reports for indications of infection or dehydration. Remove excess blankets when the client feels warm, but provide extra warmth when the client feels chilled. Provide adequate nutrition and fluids, example, 2,500 to 3,000 ml/day, to meet the increased metabolic demands and prevent dehydration. Measure intake and output. Reduce physical activity to limit heat production, especially during the flush stage. Administer antipyretics, drugs that reduce the level of fever, as ordered. Provide oral hygiene to keep the mucous membranes moist. Provide a tepid sponge bath to increase heat loss through conduction. Provide dry clothing and bed linens. Clinical manifestations. Hypothermia. Decreased body temperature, pulse, and respiration, severe shivering, initially, feelings of cold and chills, pale, cool, waxy skin, frostbite, discolored, blistered nose, fingers, toes, hypotension, decreased urinary output, lack of muscle coordination, disorientation, drowsiness, progressing to coma. Nursing interventions for clients with hypothermia. Box 29-3. Provide a warm environment. Provide dry clothing. Apply warm blankets. Keep limbs close to body. Cover the client's scalp with a cap or turban. Supply warm oral or intravenous fluids. Apply warming pads. This results in frostbite. Frostbite most commonly occurs in hands, feet, nose, and ears. Managing hypothermia involves removing the client from the cold and rewarming the client's body. For the client with mild hypothermia, the body is rewarmed by applying blankets for the client. Side advantages, disadvantages: oral accessible and convenient thermometers can break if bitten. Inaccurate if client has just ingested hot or cold food or fluid or smoked. Could injure the mouth following oral surgery. Rectal reliable measurement inconvenient and more unpleasant for clients, difficult for client who cannot turn to the side. Could injure the rectum. Presence of stool may interfere with thermometer placement. Axillary safe and non-invasive. The thermometer may need to be left in place a long time to obtain an accurate measurement. Tympanic membrane readily accessible, reflects the core temperature. Very fast, can be uncomfortable, and involves risk of injuring the membrane if the probe is inserted too far. Repeated measurements may vary. Right and left measurements can differ. Presence of cerumen can affect the reading. Temporal artery safe and non-invasive. Very fast, requires electronic equipment that may be expensive or unavailable. Variation in technique needed if the client has perspiration on the forehead. Table 29-1. Advantages and disadvantages of sites used for body temperature measurements. M29B_Berm 4360_10_SE_CH29.IND 481 February 12, 14, 5:51 p.m. 482 Unit 7 Assessing Health. Number 153613 CUST, Pearson O. Berman PG Number 482 Title, Kosier, and Herbs Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. The tympanic membrane, or nearby tissue in the ear canal, is a frequent site for estimating core body temperature. However, tympanic temperature measurements have been shown to be imprecise. Rubia, Arias, Sierra, and Aguirre Jamie, 2011. If the probe fits too loosely in the ear canal, the reading can be lower than the true value. Electronic tympanic thermometers are found extensively in both inpatient and ambulatory care settings. The temperature may also be measured on the forehead using a chemical thermometer or a temporal artery thermometer. Forehead temperature measurements are most useful for infants and children when a more invasive measurement is not necessary. However, temporal artery temperature measurements have shown inconsistent reliability. Penning, van der Linden, Tibble, and Evenhuis, 2011. Rubia et al., 2011. Types of thermometers. Traditionally, body temperatures were measured using mercury in glass thermometers. Such thermometers, however, can be hazardous due to exposure to mercury, which is toxic to humans, and broken glass should the thermometer crack or break. In 1998, the U.S. Environmental Protection Agency and the American Hospital Association agreed to the goal of eliminating mercury from healthcare environments. Hospitals no longer use mercury in glass thermometers, and several cities have banned the sale and manufacture of them. However, the nurse may still encounter this type of thermometer, especially in the home. In some cases, plastics have replaced glass and safer chemicals, example, gallium, have replaced mercury in modern versions of the thermometer. Although the amount of mercury in a thermometer, or in a fluorescent light bulb, is minimal, should it break, cleanup involves several do's and don'ts. Unsealed mercury slowly vaporizes into the air, and these mercury vapors are toxic. Keep children and pets away from the area. Wearing rubber gloves, wipe mercury beads off cloth skin, or disposable items with a paper towel, and immediately place the towel into a plastic bag. Discard the bag. If the spill is on a porous material that cannot be discarded, example, carpet, a contractor trained in mercury disposal may be needed. If the mercury is on a hard surface, use folded stiff cardboard to slowly gather the beads and pour them into a wide-mouthed container. Use a flashlight to search for the beads since the light will reflect off the mercury. Dispose of all items used in the cleanup in a plastic bag that is sealed with tape. Shower or wash well. Keep the area well ventilated for several days. Do not use any type of vacuum cleaner or broom since these will disperse the mercury and be contaminated. Do not pour the mercury down a toilet or drain, and do not wash or reuse contaminated materials. Figure 29-5 Electronic thermometers. A. Institutional model. Note the probe and probe cover. B. One-piece home electronic thermometer. A. B. With ovulation. Hypothermia thermometers have a greater low range than everyday thermometers, usually measuring temperatures from 27.2 degrees Celsius to 42.2 degrees Celsius, 81 degrees Fahrenheit to 108 degrees Fahrenheit. Chemical disposable thermometers are also used to measure body temperatures. Chemical thermometers have liquid crystal dots or bars that change color to indicate temperature. Some of these are single-use and others may be reused several times. One type that has small chemical dots at one end is shown in figure 29-6. To read the temperature, the nurse notes the highest reading among the dots that have changed color. These thermometers can be used orally, rectally, or in the axilla. Temperature-sensitive tape may also be used to obtain a general indication of body surface temperature. It does not indicate the core temperature. The tape contains liquid crystals that change color according to temperature. When applied to the skin, usually of the forehead or abdomen, the temperature digits on the tape respond by changing color. Figure 29-7. The skin area should be dry. After the length of time specified by the manufacturer, example, 15 seconds, a color appears on the tape. This method is particularly useful at home and for infants whose temperatures are to be monitored. Electronic thermometers can provide a reading in only 2 to 60 seconds, depending on the model. The equipment consists of an electronic base, a probe, and a probe cover, which is usually disposable, figure 29-5. Some institutional models have a different circuit and probe for oral and rectal measurement. Two special types of oral thermometers are basal and hypothermia. A basal thermometer is calibrated with 0.1 degrees Fahrenheit intervals and is for fertility purposes, indicating the temperature rise that is associated. Safety alert. Whenever mercury in glass thermometers are encountered, the nurse should recommend their immediate replacement with less hazardous thermometers and their safe disposal. Safety. M29B_BERM 4362_10_SE_CH29.IND482 February 12, 5:51 p.m. Chapter 29 Vital Signs 483. Number 153613 CUST, Pearson, Berman PG Number 483 Title, Kosier, and Herb's Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. For example, when the Celsius reading is 40. F equals 43 and 9/5, 132 equals 72 132 equals 104. Skill 29-1 explains how to measure body temperature. Infrared thermometers sense body heat in the form of infrared energy given off by a heat source, which, in the ear canal, is primarily the tympanic membrane, figure 29-8. The infrared thermometer makes no contact with the tympanic membrane. Temporal artery thermometers determine temperature using a scanning infrared thermometer that compares the arterial temperature in the temporal artery of the forehead to the temperature in the room, and calculates the heat balance to approximate the core temperature of the blood in the pulmonary artery. The probe is placed in the middle of the forehead, and then drawn laterally to the hairline. If the client has perspiration on the forehead, the probe is also touched behind the earlobe so the thermometer can compensate for evaporative cooling, figure 29-9. Temperature scales. Sometimes a nurse needs to convert a body temperature reading in Celsius, centigrade, to Fahrenheit, or vice versa. Although the conversion can be accomplished using several different formulas, the most common is described here. To convert from Fahrenheit to Celsius, deduct 32 from the Fahrenheit reading, and then multiply by the fraction 5/9, that is. C equals Fahrenheit temperature 232, 3 and 5/9. For example, when the Fahrenheit reading is 100, C equals 100232, 3 and 5/9 equals 68, 3 and 5/9 equals 37.8. To convert from Celsius to Fahrenheit, multiply the Celsius reading by the fraction 9/5, and then add 32, that is. F equals Celsius temperature 3 and 9/5, 132. Figure 29-7 A temperature-sensitive skin tape. Figure 29-8 An infrared, tympanic, thermometer used to measure the tympanic membrane temperature. Figure 29-9 A temporal artery thermometer. Copyright A. Wilson/Custom Medical Stock Photo. 100 101 102 103 104. 96 97 98 99. Degree F.0.2.4.6.8. Ax. 100 101 102 103 104. 100 101 102 103 104. 100 101 102 103 104. 96 97 98 99. Degree F.0.2.4.6.8. 96, 97, 98, 99. Degree F. 0.2.4.6.8. A. B. C. D. Figure 29 to 6 chemical dot thermometers. A. Axillary. Note the ax on the stem. B. Rectal. Note the plastic cover. C. Oral. D. An enlargement showing a reading of 99.2 degrees Fahrenheit. M29B _ berm 4362_10_SE_CH29.IND 483 February 12, 14, 5:51 p.m. 484 Unit 7 Assessing Health. Number 153613 CUST, Pearson O. Berman PG Number 484 Title, Kosier, and Herbs Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. Purposes to establish baseline data for subsequent evaluation to identify whether the core temperature is within normal range to determine changes in the core temperature in response to specific therapies, example, antipyretic medication, immunosuppressive therapy, invasive procedure. Equipment thermometer sheath, or cover water-soluble lubricant for a rectal temperature. Assessment assess clinical signs of fever, clinical signs of hypothermia. Planning delegation. Routine measurement of the client's temperature can be delegated to unlicensed assistive personnel, UAP, or be performed by family members/caregivers in non-hospital settings. The nurse must explain the appropriate type of thermometer and site to be used and ensure that the person knows when to report an abnormal temperature and how to record the finding. The interpretation of an abnormal temperature and determination of appropriate responses are done by the nurse. Implementation preparation check that all equipment is functioning normally. Performance 1. Prior to performing the procedure, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do, why it is necessary, and how he or she can participate. Discuss how the results will be used in planning further care or treatments. 2. Perform hand hygiene and observe appropriate infection prevention procedures. Apply gloves if performing a rectal temperature. 3. Provide for client privacy. 4. Position the client appropriately, example, lateral or Sims position for inserting a rectal thermometer. 5. Place the thermometer, box 29-4. Apply a protective sheath or probe cover if appropriate. Lubricate a rectal thermometer. 6. Wait the appropriate amount of time. Electronic and tympanic thermometers will indicate that the reading is complete through a light or tone. Check package instructions for length of time to wait prior to reading chemical dot or tape thermometers. Evaluation. Compare the temperature measurement to baseline data, normal range for age of client, and client's previous temperatures. Analyze considering time of day and any additional influencing factors and other vital signs. Conduct appropriate follow-up such as notifying the primary care provider if a temperature is outside of a specific range or is not responding to interventions, giving a medication, or interprofessional practice. Measuring the temperature may be within the scope of practice for many healthcare providers. Although these other providers may verbally communicate their findings and plan to the healthcare team members, the nurse must also know where to locate their documentation in the client's medical record. 7. Remove the thermometer and discard the cover or wipe with a tissue if necessary. If gloves were applied, remove and discard them. Perform hand hygiene. 8. Read the temperature and record it on your worksheet. If the temperature is obviously too high, too low, or inconsistent with the client's condition, recheck it with a thermometer known to be functioning properly. 9. Wash the thermometer if necessary and return it to the storage location. 10. Document the temperature in the client record. A rectal temperature may be recorded with an R next to the value, or with the mark on a graphic sheet circled. An axillary temperature may be recorded with AX or marked on a graphic sheet with an X. Altering the client's environment. This includes teaching the client how to lower an elevated temperature through actions such as increasing fluid intake, coughing and deep breathing, cool compresses, or removing heavy coverings. Interventions for hypothermia include intake of warm fluids and use of warm or electric blankets. Clinical alert. Be sure to record the temperature from an electronic thermometer before replacing the probe into the charging unit. With many models, replacing the probe erases the temperature from the display. To monitor clients at risk for imbalanced body temperature, example, clients at risk for infection or diagnosis of infection, those who have been exposed to temperature extremes. Site and method most appropriate for measurement factors that may alter core body temperature. Clean gloves for a rectal temperature towel for axillary temperature tissues/wipes. Assessing body temperature. Skill 29-1. M29B_Berm 4362_10_SE_CH29.IND484 February 12, 14, 5:51 p.m. Chapter 29 Vital Signs 485. Number 153613 CUST, Pearson, Berman PG number 485 Title, Kosier, and Herb's Fundamentals of Nursing 10 EC/M/Y/K Normal Design Services of S4 Carlisle Publishing Services. Vital Signs Record. Vital Signs Record from Cerner Electronic Health Record. Copyright by Cerner Corporation. Used by permission of Cerner Corporation. Assessing body temperature, continued. Skill 29-1. Box 29-4 Thermometer placement. Oral place the tip on either side of the frenulum. Rectal apply clean gloves. Instruct the client to take a slow deep breath during insertion. Never force the thermometer if resistance is felt. Insert 3.5 centimeters 1.5 inches in adults. Axillary pat the axilla dry if very moist. The tip is placed in the center of the axilla. Oral thermometer placement. Positioning a temporal artery thermometer. Copyright Exergen Corporation. All rights reserved. Pull the pinna of the ear up and back for an adult while inserting the tympanic thermometer. Placing the tip of the thermometer in the center of the axilla. Inserting a rectal thermometer. Tympanic pull the pinna slightly upward and backward for an adult. Point the probe slightly anteriorly, toward the eardrum. Insert the probe slowly using a circular motion until snug. Temporal artery brush hair aside if covering the temporal artery area. With the probe flush on the center of the forehead, depress the red button, keep depressed. Slowly slide the probe midline across the forehead to the hairline, not down the side of the face. Lift the probe from the forehead and touch on the neck just behind the earlobe. Release the button. M29B_Berm 4362_10_SE_CH29.IND485 February 12, 14, 5:51 p.m. 486 Unit 7 Assessing Health. Number 1